Interventions are something that everyone in the occupational therapy field has heard about and knows about. One treatment intervention that particularly interested me was dry needling. Throughout this speech, I will discuss what dry needling is, why we do it, who can do it, and I will provide 3 questions and answers to go with it that pertain to dry needling. First, let's discuss what dry needling is. Dry needling is an intervention treatment similar to acupuncture because the same type of needles are used. These are placed in the trigger points in your body to help release the pain. It does cause the patient some pain and discomfort, but eventually it helps to reduce it. Secondly, let's explore why we dry needle. In the article, Dry Needling, Peripheral and Central Considerations, Volume 19, Issue 4, November 2011, from the Manny Publishers online platform web pages says this. From a pain science perspective, trigger points are constant sources of peripheral and central sensitization. Dry needling can not only reverse some aspects of central sensitization, it reduces local and referred pain, improves range of motion and muscle activation patterns, and alters the chemical environment of trigger points. They also stated that trigger point dry needling should be based on a thorough understanding of the scientific background of trigger points, the differences and similarities between active and latent trigger points, motor adaptation, and central sensitized application. Finally, let's identify who can administer these dry needlings. In order to provide this intervention treatment, a clinician must be certified in dry needling, and they must be operating in the scope within their practice. Each state has their own set of guidelines and rules that they need to follow, and so far I've found that this is only a healthcare professional certification program. In conclusion, we have learned that dry needling is a treatment intervention that uses needles to release trigger points in the body to promote healing. We discussed that the purpose for using this method is for the release of pain. And finally, we identified that professionals are the ones who should be administering this treatment. How long does it take? This varies on the amount of needles used on trigger points, but generally does not last as long. Can you have dry needling done if you're pregnant? There are a lot of debates on this subject, but in the description of dry needling in clinical practice, an educational resource paper produced by the APTA Public Policy Practice and Professional Affairs Unit, February 2013, it says in the precautions, section number 13, dry needling during the first trimester of pregnancy, during which miscarriage is fairly common, must be approached with caution, even though there is no evidence the dry needling has any potential abortifacient effects. What are the side effects? According to the Baylor Scott and White Health webpage article, Dry Needling Side Effects, the side effects include temporary increase in pain, which may occur within 24 to 48 hours after treatment may be resolved with light massage, gentle stretching of the area, and general activity, mild bleeding or bruising at the insertion site, a rare occurrence, which is only 10% of cases, patients that are at risk are people on blood thinning medications, blood vessel problems, blood vessels close to the skin. Fainting is a rare occurrence. Patients most at risk are healthy, athletic young men, middle-aged women with blood pressures lower than 120/70, older or weaker individuals with lower energy levels, people who are hungry, dehydrated, who eat right before treatment. Fatigue and drowsiness are general lethargy and weakness. You have skin reactions, small red spots on your skin. A histamine reaction usually subsides on its own in a few minutes to a few hours. And pneumonia thorax, which is collapsed lung, is extremely rare, occurs only if the needle pierces your chest cavity as your lungs lie close to your chest wall. Not a life-threatening condition, but requires immediate medical attention. Thank you.